Hi, it's Dr. William Storms, board certified allergist and specialist in asthma. Today we'll talk about exercise asthma diagnosis. Now, in order to diagnose the condition, you have to have a breathing test. Here's a typical breathing test. Patient blows very hard into the machine. Then the machine gives you a printout with all these numbers. Most of these numbers you don't need, but what you want to look for is the FEV1, forced expiratory vowel in 1 second. That means the amount of air you blow out in 1 second. The machine will give you a what's called percent predicted, which is the percent of normal that your breathing is compared to a normal person. And I've underlined the number, which in this patient was 89% of normal. So what we look for is 80 to 100% of normal, and that's the normal range. Now, anywhere in that 80 to 100% is normal. So if you're between 80 and 100%, you're considered normal theoretically. However, if you exercise regularly, your breathing may be better than the average person. So what we always do is we do the breathing test, then we give an inhaler like an albuterol or a nebulizer and repeat the breathing test again. And for people who have done a lot of aerobic exercise, their breathing test may be better than normal. So it'll be 110% of normal, 130%. So that's what's called your personal best. So the breathing test has to be done before and after the bronchodilator inhalation, even if it's normal to begin with. Then that gives you an idea of whether you really have exercise asthma. Also realize that it may be totally normal when you do the breathing test and it only drops when you do exercise. Now, what do you do then? Well, you could get a peak flow meter, which you can get at a pharmacy. You blow into that a few times when you're just sitting around the house. Then you do it before and after exercise. If it drops 20%, that pretty much makes the diagnosis. Now, the trick to doing this test is, number one, find the doctor that has that machine, a little average machine in their office. Usually that's an allergist. Some pulmonary specialists have it. And then go in and get the test, see what the result is, and ask for the number. What percent of normal are you?